Hello everyone, happy evening, a very good evening. Am I audible and visible, everyone? All right, that's great, amazing. So I hope and I believe all of you are doing well, guys. And here we are to discuss the Fast 5 test that we had on the Medsynapse app. I hope you've given the test, and I hope you fared well in the test. So how did you find the test, everybody? I mean, the questions were on the frequently asked topics, just that the questions were long stem questions and a bit like, twisted questions. That's it. Otherwise, these are very much the topics that you should definitely know. Okay. So, let's start with our discussion. And for everybody who's there on the app, we also have our next class, in-app live class, which is there. OBGY, which is 18th, that is tomorrow. We will have OBGY KBMD, that's Kaun Banega MD, a live MCQ discussion with leaderboard in-app for subscribers. Right, so tomorrow 6:30 p.m. we will have OBGY session. Okay, yeah, thank you everyone. So this is on 18th, and on 22nd we will have ophthalmology, right? So that's the plan there, and let us start discussing the questions. This is the first question. What do you think is the answer to this one? Right, if you've given the test already, you know the answer. Otherwise, what do you think is the answer to this question here? Yes. The answer is B or the answer is C? 2.5% or 5%? What do you think will be the answer to this one, right? This is a very frequently asked question, right? So try to understand this question, right? First of all, sample of 100 individuals, mean is given as 7,500, mean WBC count. Standard deviation is 1,000, right? It's a normal distribution. So what is the percentage that a randomly selected individual will have a TLC less than 5,500? Right? So they have given you that the mean is 7,500, standard deviation is 1,000, and how much will be less than 5,500? So basically the value that they have given you here is how much times, how many standard deviation less than the mean? 7,500 minus 5,500. So that's basically 2,000. How much is the one standard deviation? 1,000. So 2,000 is going to be 2 standard deviation. So the value that they've given you is mean minus 2 standard deviation. Okay, that is the cutoff that has been given. Now you know that in a normal distribution, mean plus minus 2 standard deviation is how much of sample? 95%, right? Mean plus minus 2 standard deviation, this covers 95%. Okay, this covers 95%. So if I take the cutoff here according to the question that we have, this one here is 7,500. 1,000 minus 1 standard deviation, this is going to be 6,500. This is going to be 5,500, right? So here you have 95% population. So the remaining population, that is 5%, that will be divided into 2, that is 2.5 and 2.5 percentage. So basically 2.5% will be below 5,500 and 2.5% will be above 9,500. Okay, this is going to be 9,500, 8,500 because the standard deviation is 1,000. Is this clear with everyone? Yes, Sagar, absolutely. Like I said that these are very, very frequently asked questions. No, Akash, the question is basically this cutoff 5,500 के नीचे कितना होगा? तो सिर्फ इतना ही has been asked. So this is going to be 2.5%, lower than 5,500. ठीक है? Is this clear with everyone? Next time if they ask you that above 9,500, then again it is going to be 2.5%. Clear? Everybody, is this clear? So the answer here is going to be 2.5%. Okay, it's not going to be 5%. Is this clear with everyone? Yes? Next time if I ask you the question that how many will be below 6,500? So how much is going to be below 6,500? So 6,500 is one standard deviation. Plus minus one standard deviation is 68%. So remaining 32% you will divide into 2. So this is going to be 16% and this is going to be 16%. So less than 6,500 is going to be 16%. Is this clear? Right? Very, very important question, right? Expect such biostats question in your exam. You do not need any pen and paper which you're not given in your NEET PG and FMG exam for this calculation, right? So in that case, the answer will be 16. Absolutely right. Yes, correct. Dipanshu, Nirday, Sharavali, Rumisha, I see all the familiar names I see in in-app live classes as well. Good to see you here as well. Sagar, correct. Okay. So that was the first question, guys. Going on to the next question, question number 2. What do you think will be the answer to this one? See, first of all, learn the MCQ skills that when you are given long stem questions, which majority of the questions in your exam are now long stem, start reading the question from the last line. See, whenever you move to a question, maybe in your grand test or even in your final exam, first look at the options, because from the options you get an idea that this is related to what system, what subject. So carotid pulse, Cannon waves, jugular venous pulse. So I know that this is something related to cardiology, right? Next, what I will do is read the last line. Which of the following additional findings of on examination of neck is most consistent with these findings? The last line is not telling me anything. So in that case, then I will read the second last line. The onset of symptoms was preceded by episode of prolonged substernal chest pain. When it is given substernal chest pain, you start thinking of angina, right? Now, still I'm not able to solve, then I will go and read the question from the first, that is orthopnea, dyspnea, edema which is there, plus which was preceded by this, angina which is there. So what is this question basically? Yes, Akash, correct. If they ask you outside mean plus minus 2 standard deviation, then it will be 5%. Right, so in that case, it's going to be less than 5,500 and more than 9,500. Then it will be total will be 5%. So tell me, what is the diagnosis here in this case, guys? So when there's orthopnea, right, there is pedal edema, edema of the lower extremities, like then there was the substernal chest pain, angina, MI, which is there. So what are you thinking of? What is the diagnosis in this case that you are thinking of? Very good, Dipanshu. Absolutely right. So basically, you are thinking of heart failure. This is a patient of acute heart failure with pedal edema being there. You think of right heart failure, left heart failure. This is right-sided heart failure because there's going to be pedal edema in right-sided heart failure. When there is left-sided heart failure, what edema do you get in left-sided heart failure? So when there's left heart failure, left ventricle failing, giving back pressure to the left atrium, giving back pressure to the pulmonary veins, that is lung, in that case, it is going to be pulmonary edema is going to be present, right? So pulmonary edema is going to be present in left heart failure, pedal edema, hepatomegaly, right? And so basically from the right side, the right ventricle, right atrium, you have SVC and IVC. So it's going into the jugular vein. And that is why you will have raised JVP, right? So raised JVP, and that is why the correct answer here is going to be JVP of 12 mm, 8 to 10 is normal. So this is raised JVP is what you are going to see in a right heart failure. Is this clear with everyone? So the answer here is going to be jugular venous pressure of 12 millimeters of mercury. Okay, this is going to be the answer here. Where do you see a bifid carotid pulse? So bifid, basically in the systole, here you are seeing two peaks. This is going to be aortic regurgitation, right? Aortic regurgitation may be coupled with aortic stenosis as well. Then you have carotid bruit, best heard at the carotid bifurcation, wherever there is bruit. So basically, maybe you are thinking of stenosis, narrowing, which is happening there, which is because of atherosclerosis, right? So carotid atherosclerosis, which can lead to TIA, stroke. That is what you think of. Then Canon A waves, we have discussed JVP with all the tricks in sure shot, right, in the Medsynapse app. Canon waves are seen with Canon waves, right? The A waves, which are very, very tall because the atrium and ventricle are not in sync. So that is complete heart block. Okay, complete heart block will have this Canon waves. Okay, is this clear with everyone? Yeah, even HOCM can give that, Shweta, correct. Ayushman, right, facial edema, more so than you think of like SVC obstruction, because the venous drainage is not happening, any organ, any area where the drainage is not happening, it will get edematous, right? So SVC obstruction is also a cause of that. Right, clear with everyone? So the answer here is going to be a raised JVP. Remember, in right-sided heart failure, there's hepatomegaly, right? Then there is raised JVP, there is pedal edema, while in left heart failure, there is pulmonary edema. Okay, there is pulmonary edema. Okay, so that was the second question there. Going on to the third question, right? Follow the tricks that I've told you. Look at the options, look at the last line, second last line, then you read the rest of the question. Okay, then if you're preparing for FMG, first focus on the FMG questions, build your foundation, build your base, and then do the UPSC CMS questions because they are in more detail and depth, right? So first building your foundation base is very important. Then 1 month prior to the exam, 1 month, 1.5 months prior to UPSC CMS, you can do your those questions. Very good, Shiravali. Absolutely right. So these are the options that we are seeing: neuraminidase, polymerase. So from there, you know that something related to viral, antiviral. You can neuraminidase, that is where we read there. The most appropriate pharmacotherapy for this patient is a drug that inhibits which of the following? Which patient? 1 day later, there's group of vesicles containing clear fluid on the lower lip. Whenever I see vesicles, right, grouped vesicles, what infection do I think of? HSV, right? Herpes simplex virus, because even herpes में जो genital ulcer भी होता है उसमें vesicles होते हैं, right? So vesicles is basically HSV, and you know that the drug of choice for HSV is acyclovir, right? It is acyclovir. And what is the mechanism of action of this acyclovir? Acyclovir, look at this one. So acyclovir by this herpes virus specific thymidine kinase. Please remember this enzyme is thymidine kinase and not thymidine synthetase. Okay, and this is virus specific one. So that is converted to monophosphate, right? Then you have acyclovir triphosphate, and this is what inhibits the DNA polymerase. Okay, and it leads to the termination in the DNA replication. Okay, it stops the lengthening of the DNA strand and it inhibits DNA polymerase. So remember the answer here, acyclovir basically inhibits DNA polymerase. That is what is going to be the answer here. न्यूरामिनिडेज वाला ड्रग कौन सा है? अगेन समथिंग वी हैव डिस्कस्ड इन शॉर्ट शॉर्ट. न्यूरामिनिडेज वाला कौन सा है? न्यूरामिनिडेज. Yes, correct, Nakash. Above waist HSP1, below waist HSP2. Neuraminidase, MI wale drugs, oseltamivir, zanamivir, right? So remember, oseltamivir. So that is neuraminidase wala drug. Okay, that is neuraminidase wala drug. Clear with everyone? Yes, Brunda. The surplus topics which are over and above your short and extra, you have to definitely do those. Okay, they are very, very important as well. Yes. Okay. So this is about acyclovir. Remember, this is DNA polymerase, and before giving acyclovir, what should you test for? This is another question which is asked. Because acyclovir is nephrotoxic, remember you need to check serum creatinine. Okay, check serum creatinine before giving acyclovir. Very, very important. Another important point for, other very, very frequently asked point that you should never ever forget, HSV encephalitis predominantly affects which lobe? HSV, when it causes encephalitis, it predominantly affects which lobe? Right? That's a keyword there. It has been asked in the recent NEET PG exam, FMGE exam. HSV encephalitis is which lobe? There's the HLAB 5701, that's for abacavir, right? HIV wala drug. Do not confuse acyclovir and abacavir. Very good. Remember, that is temporal lobe. So whenever you have temporal lobe encephalitis, you should always think about HSV, right? CSF PCR is what you do for diagnosis. Another question that has been asked in one of the recent NEET PG exam. Okay. So that was the third question there. Going on to the next question. Tell me, what do you think is this question asking? Never mind it. It's always better to get confused in the discussions before the exam so that you do not do the mistake in the exam. Right? And that is why, thinking actively is important when we are doing these discussions rather than just listening to it very passively, because you learn more with the active thinking. Very good. Amazing, guys. This is congenital syphilis. How do you know this is congenital syphilis? A persistent mucopurulent nasal discharge, malformed teeth, right? Hutchinson's teeth, mulberry molars, skin cracks and fissures around oral, anal, vulvar orifices. So that's basically regards, right? All this regards, that is fissures which are seen, oral wala, yahan pe, vulvar, all this is basically all the features of congenital syphilis. Okay, so the diagnosis here is congenital syphilis. So congenital syphilis, which one is going to be correct? Is it inability of maternal rubella antibodies? This is not rubella, this is not herpes, this is not CMV. So maternally transferred spirochetes replicating in fetal tissue, this is correct because this is what causes syphilis. Spirochetes, Treponema pallidum, that is what causes syphilis. Absolutely right. Can you tell me the incubation period for syphilis, guys? What is the incubation period for syphilis? This is also has been asked in one of the recent exams. Incubation period? Very good. Anonymous 007. Congenital syphilis is the only syphilis where you can see vesiculobullous lesions, right? In the cutaneous manifestation. Otherwise, you don't see it in syphilis. The incubation period, correct. It is 9 to 90 days. Okay, it varies from 9 to 90 days. Right, when there is syphilis, it's a hard chancre. Remember, syphilis, single, solitary ulcer, which is going to be there. It is painless. Syphilis is painless. Painless ulcer, painless lymph nodes is what you see. Dark field microscopy is used, right? For treatment response, what investigation do you use to look at the treatment response in a patient? It is VDRL, right? VDRL for treatment response. Oh, I'm invisible. Why? I can see myself. Okay, so that anonymous is Shelby, and Shelby is someone else. Shubham or Shivam? Right, correct, guys. So this is clear with everyone. Congenital syphilis. What is the triad of congenital syphilis? Remember Gandhi ji ke teen bandar, बुरा मत सुनो, बुरा मत देखो और बुरा मत बोलो. So there is SNHL, there is interstitial keratitis, and there is Hutchinson's teeth. Okay, the Hutchinson's teeth, the incisors, not the mulberry molars. It is sensory neural hearing loss, not the conductive hearing loss. That is what you have to remember. Okay. Yeah. Going on to the last question, question number 5 in the fast 5 discussion. Tell me, what do you think is the answer to this one? Very good, Dipanshu. Right, it's a simple concept based question, but the way the question has been framed, that is tricky. And these are the type of questions that you expect in your exam. Yes. Okay, very good. The answer here is hemophilia B. Why is it hemophilia B, guys? Because what is normal? PT, bleeding time, platelet count, everything is normal. When the PT is normal, that means what pathway is normal? When the PT is normal. Remember the mnemonic, guys. What is the mnemonic for this? Happy and wept. I hope you remember this. Happy and wept. Heparin, APTT, intrinsic pathway. Warfarin, extrinsic, prothrombin time. It's PT. So when the PT is normal, the extrinsic pathway is normal, right? So remember factor 7, another mnemonic here. 7 is in heaven, that is outside, extrinsic pathway. So this is going to be extrinsic pathway which is going to be there. So PT will be increased. Next, it is given the PTT is prolonged. That means the intrinsic pathway is affected, right? So yeah, factor 8, factor 9 comes there. Correct. Okay. So what is given here is it corrects after the addition of plasma from a patient with hemophilia A. Hemophilia A is factor 8 deficiency. So if the patient had hemophilia A and you are giving hemophilia A patient ka plasma, it will not get corrected because both of them are having factor 8 deficiency. So the hemophilia A patient is having factor 8 deficiency, but the factor 9 is normal, and that is why it is correcting hemophilia B ke patient ka PTT. Right? Is this clear with everyone? So the correct answer here is going to be hemophilia B, which is factor 9 deficiency. And tell me that hemophilia B is what inheritance? Hemophilia A, hemophilia B, hemophilia C. What is this? A and B are X-linked recessive. Remember another story mnemonics to remember the inheritance and short we have discussed. Hemophilia C वाली story में ये क्या है? Basically this is autosomal recessive, right? Wilson वाला story, Wilson goes in taxi to the C. Alright, so remember it is C wala is autosomal recessive, AB is X-linked recessive. Okay? Yes, very good. Right? Intrinsic pathway is 8 to 12 except 10. Right? 10 is the common pathway. So 8 to 12 except 10. So that comes in your intrinsic pathway. Very good. Okay. So this was about your fast 5 questions for today. Right? Quickly tell me, right, let's try to do the recall of what were the fast 5 questions that we discussed today. What was the first question that we discussed? What was the first question that we discussed, guys? Yes, yeah, the biostats wala question, standard deviation wala biostats, mean plus minus 2 standard deviation wala, basically less than minus 2 standard deviation पूछा था. Next कौन सा question था? Second question. What was the next question? Let us quickly revise the 5 topics that we have learned today. Very good. PSM वाला standard deviation. Next कौन सा था उसके बाद? Acyclovir. What was the next question? Okay, heart failure. Very good. We spoke about right-sided heart failure, where we read about pedal edema and raised JVP. That is what we learned is what is present in right-sided heart failure, hepatomegaly and all of that. Third question was acyclovir wala herpes labialis mein. The mechanism of action of acyclovir is it inhibits DNA. polymerase, right? It inhibits DNA polymerase, not neuraminidase, DNA polymerase. It uses virus-specific thymidine kinase, converted into acyclovir triphosphate. What was the next question then? It was on congenital syphilis, right? Spirochetes wala congenital syphilis, where there are malformed teeth, there are fissures which are present, very, very important. Mucopurulent nasal discharge is present. What was the fifth question which was there? The last question. Hemophilia B, right? Hemophilia B will have raised APTT because it is intrinsic pathway, right? 8, 9, 11, 12. Corrected after giving hemophilia B patient का plasma. Hemophilia, sorry, A patient का plasma, B नहीं, B में B नहीं चलेगा. Hemophilia A patient का plasma देने के बाद वो correct हो जाएगा. It's going to be prolonged APTT, right? Prolonged APTT. The last question before we call off for the session, tell me that hemophilia A, hemophilia B, both of them have raised APTT. So how will you differentiate the two? How will you differentiate the two? Hemophilia A and hemophilia B. Both of them have raised APTT. Yes. Very good. SRR, correct, right? Your factor 8, basically you have related to von Willebrand factor as well, stabilizing there. And that is why with hemophilia A, the von Willebrand factor, which is responsible for platelet adhesion, so that is also affected. When the platelet is affected, the bleeding time is affected. I hope you know this concept. And that is why, right, the bleeding time will also be increasing there. Okay, is this clear? Alright, it's the other way around. Von Willebrand factor, von Willebrand disease में basically ये होता है. The von Willebrand factor is important for stabilizing factor 8, not the other way around. Sorry, I told the other way around. Von Willebrand factor is important for stabilizing factor 8. So in von Willebrand disease is the condition basically which has the bleeding time also prolonged and the APTT also prolonged, right? So the basic question that I wanted to ask was von Willebrand disease and hemophilia A. How do you differentiate? Both of them have raised APTT. In von Willebrand disease, the bleeding time will also be increased. So very, very important question. When you have increased bleeding time and increased APTT, you think of von Willebrand disease, right? You do the factor aside test, correct? Okay, clear with everyone? Right, very good, G2. That's another important point there. Hemophilia A responding to cryoprecipitate. Correct. All right, guys. So this was about the Fast 5 test for today. I hope you'll remember the concepts, right? A short, crisp, concise discussion of the important questions and the related topics, right? All the app subscribers, the Medsynapse app subscribers, I'll see you tomorrow at 6:30 p.m. for OBGY discussion, right? OBGY KBMD is what we have tomorrow. Both NEET PG and FMG students for both of them, right? So that is what we are going to do, OBGY. Okay? All right. Yes, Sagar, there's no option without revising. GT score is struck below 100 questions even after so many GT. Sriharsha C. First of all, if you're not using Medsynapse app, start using it because you learn a lot of tricks which help you big time in your GTs. So first is that. If you're doing that, you've done that, and even then you are feeling that I'm stuck, then please analyze that where you are going wrong. Okay, is it recall error? Is it silly mistake? Is it something that you don't know only? So once you analyze your mistakes like this, then only you'll be able to work on those and improvise your scores. Okay. Great, Sagar. Just keep revising. There are UPSC CMS PYQ discussion also in the app. Have a look at it to understand that what kind of questions are asked and how do you approach the questions. In any exam, smart work is very important. First you should look at the PYQs and see कि paper आता कैसा है. Okay. Thank you so much, everyone. I'll try to do that as often as possible, though not promising daily. Okay. All Right, guys. Thank you so much. And Brinda Khaira is not here, busy with her friends playing out, right? So, enjoying her childhood. Okay. Thank you so much, everyone, for joining in. See you all tomorrow on Medsynapse app for OBGY KBMD at 6:30 p.m. Till then, goodbye. Take care. And keep studying, keep revising.